Diverticulosis is an gastrointestinal disease. Look at this picture, shows that diverticulosis and diverticulitis CT findings. Look at this MRI and X-ray, barium enema findings. Look that detail going on. Introduction. Diverticulosis is a common condition, especially in old adult, where small bulging pouches diverticula form in the lining of the digestive system, most often in the lower part of the large intestine. Diverticulosis itself usually does not cause symptoms but can lead to complications, including diverticulitis or bleeding. Definition. Diverticulosis refers to the presence of diverticula in the colon without any associated symptoms or inflammation. When one or more of these pouches become inflamed or infected, the condition is termed diverticulitis. Types. 1. Asymptomatic diverticulosis. The majority of individuals with diverticulosis are asymptomatic, meaning they do not experience symptoms. 2. Symptomatic uncomplicated diverticulosis. Rarely individuals with diverticulosis may experience symptoms like abdominal pain, changes in bowel habits without inflammation. 3. Diverticulitis. If the diverticula become inflamed or infected, it leads to diverticulitis characterized by pain, fever, and other symptoms. Causes. The exact cause of diverticulosis is not known, but it is believed to be associated with 1. Low fiber diet. A diet low in fiber and high in processed foods may lead to constipation and increased pressure in the colon, promoting the formation of diverticula. 2. Aging. As people age, the colon walls naturally weaken, making diverticula more likely. 3. Chronic constipations. Straining during bowel movements due to constipation increases colon pressure, leading to diverticular formation. Risk factors. 1. Age. Diverticulosis is more common in people over 40, with prevalence increasing significantly with age. To diet: a low fiber, high fat, and high sugar diet raises the risk. 3. Obesity: being overweight is likely to be higher chance of developing diverticulosis. 4. Physical inactivity: sedentary lifestyles can increase the risk. 5. Smoking: smoking is associated with higher rates of diverticulosis. 6. Genetic predisposition: a family history of diverticulosis may increase the likelihood of developing the condition. Complications: diverticulitis: when diverticula become inflamed or infected, diverticulitis can occur, leading to symptoms like severe abdominal pain, fever, and nausea. 2. Bleeding: diverticula can sometimes bleed, leading to blood in stool. 3. Abscess and perforation: severe inflammation can result in abscess formation or perforation of the colon, leading to peritonitis. 4. Fistulae: a rare case, fistula, an abnormal connection between organs, may form. 5. Intestinal obstruction: chronic diverticulitis may cause scarring and blockage of the colon. Pathophysiology: diverticula form when high pressure inside the colon pushes against weak spots in the intestinal walls, causing small pouches to bulge outward. These are most common in the sigmoid colon, where pressure tends to be highest. Inflammation occurs when fecal matter or bacteria get trapped inside the diverticula, leading to diverticulitis. The pathophysiology of diverticulosis involves several steps primarily related to structural changes in the colon and increased pressure. Here is step-by-step breakdown. 1. Weakening of the colon wall due to aging, structural changes, low fiber diet. 2. Increased intraluminar pressure, chronic constipation, segmental contractions, increased pressure. 3. Formation of diverticula, outpouching of the mucosa, diverticular formation. 4. Diverticulosis, presence of diverticula, asymptomatic stage, minimal symptoms. In fifth stage, diverticulitis. If diverticula become infected or inflamed, trapping of facial material or bacteria, inflammation, infection. 6 complications in diverticulitis: abscess formation, perforation, peritonitis, fistulas, scar tissue and structures. Signs and symptoms. For diverticulosis, usually asymptomatic, one often no symptoms. To some may experience mild abdominal discomfort or changes in bowel habits, constipation or diarrhea. For diverticulitis, one persistent severe abdominal pain, usually in lower left side, 2 fever, 3 nausea and vomiting, 4 changes in bowel habits such as constipation or diarrhea, 5 bloating. Diagnosis: 1. Colonoscopy. A colonoscopy can directly visualize the diverticula in the colon. 2. CT scan used to diagnose diverticulitis by showing inflamed or infected pouches. 3. Barium enema, an X-ray test where barium is introduced into the colon to show the presence of diverticula. 4. Blood tests may show signs of infection or inflammation in diverticulitis. Example: elevated white blood cell count. Nursing diagnosis: acute pain related to inflammation in the colon. 2. Risk for infection related to perforation or inflammation. 3. Constipation related to bowel irregularities and inadequate fiber intake. 4. Impaired nutritional intake due to nausea or abdominal discomfort. 5. Knowledge deficit related to diverticulosis management and dietary modifications. Management: for diverticulosis, 1. Dietary changes: a high fiber diet, fruits, vegetables and whole grains is essential in preventing further diverticular formation and complications. Avoid foods like nuts, seeds and popcorn if they aggravate symptoms. 2. Hydration: adequate fluid intake helps prevent constipation. 3. Exercise: regular physical activities reduce pressure in the colon and improves bowel function. For diverticulitis, 1. Antibiotics for mild cases of diverticulitis. Oral antibiotics may be prescribed to treat infection. To pain management, analgesics such as acetaminophen may help manage pain. 3. Clear liquid diet. In severe cases, a clear liquid diet may be recommended. temporarily to allow the colon to heal. 4. Hospitalization. Severe cases may require IV antibiotics, fluids, and sometimes surgery if complications arise, like abscess or perforation. Treatment. 1. Asymptomatic diverticulosis. Since asymptomatic diverticulosis does not cause pain or inflammation, the treatment focuses on prevention, high fiber diet, hydration, exercises, stool softness, avoidance of certain foods. To symptomatic diverticulosis. For individuals experiencing mild symptoms, example bloating, mild discomfort without inflammation, dietary adjustment, mild pain relief. 3. Diverticulitis uncomplicated. For mild diverticulitis without complications such as abscess or perforation, antibiotics, pain management, clear liquid diet, gradual reintroduction of fiber. 4. Diverticulitis complicated. For severe diverticulitis with complications such as abscess, perforation or fistula. Treatment. Hospitalization, IV antibiotics, abscess drainage, surgery, parietal colectomy, Hartmann's procedure, fistula repair. Surgery may be necessary. Five. Long-term management, post-diverticulitis, dietary changes, regular follow-up, probiotics. Psychosocial medicine. Diverticulosis and diverticulitis can significantly affect a patient's mental well-being, especially if recurrent episodes occur. Anxiety, depression and stress related to chronic illness and the fear of complications such as diverticulitis are common. Counseling or support groups can provide psychosocial support, and patient education on diet, lifestyle and disease management is crucial. Prevention. 1. High fiber diets. Eating a diet rich in fiber helping to prevent constipation and reduce the risk of diverticular formation. To regular exercise. Physical activity helps maintain normal bowel movements. 3. Avoid smoking. Smoking cessation is recommended to reduce complications. For proper hydration, drinking plenty of fluids softens stool and prevents constipation. 5. Avoid straining. Managing constipation and avoiding Excessive straining during bowel movements reduces colon pressure. In conclusion, diverticulitis is a common but often asymptomatic condition. In older adults, a high fiber diet, exercise, and healthy lifestyle choices are vital in preventing complications like diverticulitis. Proper management and early detection of diverticulitis are important to avoid severe complications, while psychosocial support is necessary for those dealing with recurrent illness. Thank you. Have a nice day.